My name is Cesar Martel. I'm an exercise physiology student in third year. I attend QUT Kelvin Grove. In this presentation, I'll introduce my client Reg Hainan and present the relevant paperwork that outlines his readiness for starting an exercise program and mention the risks involved. I'll also present my notes from our initial consultation and provide a brief needs analysis, and will conclude with a summary of my notes as well as an action plan that will aid Reg to strive for and accomplish his goals. Reg Hainan is a 52-year-old full-time carer with chronic conditions of his own. He has attended the clinic in order to reduce his pain and strengthen any relevant anatomy in order to be able to care for his dependent as well as meet the physical activity recommendations himself. In order to achieve this goal, Reg has set out to lose 10 kilos of fat mass and to increase his motivation towards exercising and to initiate an exercise program that will make him stronger and allow him to cope with rheumatoid arthritis. Before getting started with the pre-screening process, I presented Reg an informed consent form, which outlines which tests I was going to put him through and which tests may strain him physically. He understood what was presented and signed the document, which allowed me to continue with the process. Reg filled out a few questionnaires that would stratify any risk involved with starting any drastic change to physical exercise. Although the physical activity readiness questionnaire enlightened on Reg's rheumatoid arthritis, it did so by a simple tick in the yes box, and recommended he see a doctor before starting physical exercise. I felt this was not an adequate pre-screening tool when used exclusively. Therefore, in addition to the PAR-Q, I used S's adult pre-screening tool and ACSM's risk classification tool in order to be more comprehensive in the data collection. Because of his age, sedentary lifestyle, and his smoking status, the ESSA and ACSM pre-screening tools categorized him as a moderate risk. Consequently, Reg can partake in light to moderate intensity exercise, but would require medical clearance from a doctor in order to take part in any high intensity or maximal effort exercise. Reg lives a good life, scoring just above the median score on a fantastic lifestyle checklist. Primary diagnosis is that Reg is a moderate risk client that requires medical clearance before he undertakes any high strenuous exercise. His past or current physical activity does not meet the risk standards, and Reg has goals to meet the standards and then some. Simply by starting a program on light intensity, Reg will take a big step towards living a healthier life. Reg's goals are to lose 10 kilos of fat mass, increase the motivation towards exercise, and exercise safely while managing with rheumatoid arthritis. In order to lose 10 kilos, Reg will have to abide by a balanced diet according to his energy expenditure. If he adheres to the exercise program, he could possibly increase his caloric intake and still manage to lose the unwanted kilos. As for prescribing exercise, Wolfsmith, Rubinoff, Metzios, as well as De Jong and Strentgen all conclude in their respective studies that exercise is essentially the most effective countermeasure against the effects of rheumatoid arthritis. In a 2007 study, Metzios concluded that a combination of moderate aerobic exercise as well as a low to moderate progressive resistance training program would be the most beneficial for a patient with rheumatoid arthritis. Solomon 2002 says to take preventative measure for cardiovascular disease due to increased risk factors. Harcum and colleagues 2005 suggested to perform aerobic exercise 3 times a week for no less than 15 minutes per session to improve cardiovascular health and aerobic capacity. Metzios 2007 concluded that a well-constructed progressive resistance exercises are safe and effective, and that they will stimulate muscle growth and may go as far as to reverse rheumatoid cachexia. In regards to the nutritional goals, I will refer Reg to a qualified dietitian to give one-on-one advice about a nutritional plan. Optimal body composition will be the underpinning goal in regards to nutrition. In order to track future progress, I will test Reg's range of motion as well as use 5RM strength tests to coincide with the moderate workload. I will also track his diet effectiveness by measuring his skin fold measurements every 4 weeks and ask Reg to rate his pain, if any, when he exercises on a scale from 0 to 10. A safe and progressive program will be written for Reg that will include a combination of aerobic and resistance exercises that will aim at improving his cardiovascular health and improving muscle function and strength. Reg is a moderate risk client, which will need medical clearance to strive towards his goals with maximum effort. However, every single small effort adds up into an incredible feat. Therefore, I believe that Reg's goals are realistic and obtainable. Not only that, his goals feed into each other, and when they do, Reg will be living a significantly healthier life.